So when we look at Inovalon's mission, it's all around data. And it is the sharing of data, but understanding that data tells the patient's story.
We personally, at our business unit, we've developed what I think is the preeminent software in the specialty pharmacy space. And that software is allowing patients to go through the system quicker. It's allowing users and pharmacies to address the concerns that happen with all the bureaucracy around the healthcare industry and try to cut through some of that tape and get patients their life-changing meds sooner. Partners like the Crohn's and Colitis Foundation are so necessary to bring light to the problems of the different ailments that are out there in the world, right? And we each need their own focus. There's a lot of problems out there that we need to deal with, and entities like this foundation are changing a very specific and severe disease state on a daily basis. And if you didn't have that focus or that energy around a particular area, it would get lost in the shuffle. There's too much competition out there. There's too many lives we're trying to change. Bringing light up to the organizations that we work with, the pharmacies and the specialty pharmacies in particular for us, but also all the healthcare entities that Inovalon works with, whether they're payers or providers, they partner together, and we address the concerns as one, and we each play our particular role.
But so much of this disease state in particular is about the patient fighting the fight and having the faith that if they fight the fight, things will get better. So that patient advocacy part and helping them spiritually, emotionally, is as important as the medication is when we look at these disease states. The recognition of your organization, the volunteers, and the many patient advocates who are part of it, that is a really important piece to the patient puzzle.
It is the perfect partnership, and ultimately the end goal is the patient. Always is the patient. And whether it's for-profit or non-profit, the ultimate success of either entity is a curative state.
We are healthcare driven, and we are about making all of the people who deliver healthcare have the tools they need, the data they need to make better decisions faster, get patients on therapy faster. The industry has a lot of administrative burden right now, and because of it, we are seeing physicians, pharmacists, nurses leaving the industry because so much of what they're doing is administrative. So Inovalon's data and our technology solutions are helping to relieve these administrative burdens, get patients on therapy faster, help the patients maintain compliance, and understand how to manage those bumps in the road.
I mean, it's an opportunity to make a difference. Whether you're in any industry out there, I think that the bottom line is we're here for the people, and there's a lot of problems in the world which we have the opportunity to solve. Sometimes it's through money, sometimes it's through action, sometimes it's through your actual business model. And an organization that's focused solely on a particular area of need, they're doing the work for you. Now they're just looking for the funding to get it done. And that's an easy way to help that we all can do, whether it's $1, whether it's $1,000, whether it's $1 million. The idea is we together can come together to make a difference. And that's what I've modeled my career after and my life after, and to try to make that much impact as I can with a team of people that care as much or more than I do. And it's inspiring. Once you're around the people that care as much and they want to do the right thing, you'll want to do more. And we have partners like yourselves that allow us and facilitate that path so that the average person doesn't have the way that they can think to make that change. You provide that for us. And that is a service to the world generally that is, I don't think there's words that can describe how impactful it is.